Welcome everyone, and thank you for joining us in today's webinar titled Support Workers to Sit Less and Move More, the BeUpstanding Program. My name is Shelley Kirkland with the Work Wellness Institute, and I'll be moderating today's webinar. I would like to start by recognizing that I have the privilege to live and work on the traditional, ancestral, and unceded territory of the coastal Salish peoples, including the Squamish, Tsleil-Waututh, and Musqueam First Nations. We would like to thank our academic team and our 9 founding partner organizations in the Harnessing Talent Project. The Harnessing Talent Alliance for Recruiting and Retaining Canadians with Disabilities and Mental Health Challenges is a 3-year project funded by the Employment and Social Development, by Employment and Social Development Canada. This webinar is made possible through the support of ESDC as well as memberships to WWI. We thank you, our advisory committee, and speakers who contribute to this webinar series. To start, I'll go over a few technical housekeeping points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any technical issues you may be experiencing, any comments you may have, or any questions related to the webinar. We will be collecting questions submitted throughout the webinar, and following the presentation, we'll have a question and answer period. Any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website along with the slides. All registrants will be emailed the direct links for all of these items when they are available. To WWI or ARPA Australia members, a reminder that you receive free certificates of attendance. Please remember to fill in the record ID for the first time when you register for one of our live webinars. If you are not a member and would like to receive a certificate of attendance, please email our membership services team at membershipservices@workwellnessinstitute.org for more details. Today, we are very excited to have Professor Genevieve Healy and Dr. Anna Good with us. Genevieve Healy is a professor of physical activity and health at the School of Human Movement Studies at the University of Queensland, Australia. Her research focuses on understanding how much we sit and how this influences our health and well-being, as well as the feasibility and acceptability of reducing this behavior in key settings and populations, with a particular focus on desk-based workers. Her work has influenced policy and guidelines regarding the importance of reducing prolonged sitting time, and she works with multiple industry and partner organizations to translate her research into practice. This includes leadership of the BeUpstanding Program of research to support desk workers to sit less and move more for their health and well-being. Dr. Anna Good is an implementation scientist with expertise in designing, implementing, and evaluating broad-reach health behavior change interventions in applied real-world settings. Her program of research brings together training and research experience in health psychology, health promotion, and public health. She is currently the lead implementation scientist of the BeUpstanding Program, an evidence-based online program to reduce sitting time in the workplace. I'll now pass it over.
Hi, Shelley. Thank you so much to the Work Wellness Institute for the opportunity to talk to you today about our BeUpstanding program, but also some of the evidence that sits behind the program and how we then translated that into the program that's currently available today. I'd like to also acknowledge the traditional owners on the land on which I'm meeting today, the Turrbal and Yagara people, and pay my respects to the elders past, present and emerging, and recognise their valuable contributions to Australian and global society. So today it's broken up into 3 parts. So I'm going to talk part 1 and part 2, and then Anna's going to take over from me and talk about the BeUpstanding program. So first up, I'm going to do a little bit of the background and context about why are we addressing prolonged sedentary behaviour? What's the importance of doing that and looking at this behaviour that we've always done? Well, I'm then going to look at what are some of the potential solutions to support adults to sit less and move more. And then, as I said, Anna's going to take over and discuss about our BeUpstanding program, which is a workplace health promotion initiative to support work teams to sit less and move more. However, before we get started, in line with the theme today, if you are able to move, if you're listening to this on a podcast, however you're listening to this, please try not to just be still the entire time. Please feel free to move around. Take up some activity while you do this. Do move a muscle. I mean, after all, that's hopefully the point that you'll get out of this presentation that we're giving today, to create that culture where it is normative for people to be able to get up and move more regularly. So the first part, why are we addressing sedentary behaviour? But before I go into that, I really want to acknowledge that, of course, regular exercise is good for us. It has multiple physical and mental health benefits. It improves our physical health, it improves our mental health, it reduces the risk of type 2 diabetes, and it lowers the risk of early death. But let's have a little bit of a poll here. We've got some polls going. Ooh. So hopefully you should now see the, I can't see the results of the poll.
Yeah, I will let you know just as soon as we close it. So we have about 85% saying yes and 15% saying no.
Okay, fantastic. So that's wonderful. It's excellent that you're doing that. But we're living in a changing world, more so than ever before, obviously with COVID hitting onto us. Like, you know, this picture illustrates it quite well. Back in the 1990s, we had the big TV screens, and now we've got the little TV screens, but we've put the weight on other ways. With COVID pivoting to where we work and how we work, we're doing everything we really can to engineer activity out of our lives. And many of the physical activity guidelines that were originally developed were based on a time when we used to have a lot more light intensity activity embedded into our lives. So what is happening? What is happening? How are we doing that? What is the impact on our health? Well, we put these monitors onto people, like really precise monitors onto their thighs. And what that tells us is that sitting is now the predominant waking behavior. So on average, we're seeing adults are spending over half of their day sitting. The rest of the time is spent in either standing or light intensity activities. And only a very small slice of that day is spent in purposeful stepping. In public health, we've spent a lot of time trying to increase that dark green slice of the pie. But now we're recognizing we really need to consider what we're doing across the whole day and how that impacts on our health. And that's what you guys have done in Canada. So you've done the 24-hour movement guidelines for adults. So I was fortunate enough to be involved in the development of those guidelines. And they look at our sedentary time, our movement time, our sleep time, and our light intensity time, and think, how do we want to spend our whole 24-hour day? So in terms of sedentary time, these are the recommendations. We want to limit our sedentary time to 8 hours or less. So I think that's a really important point too, that we're not trying to eliminate sedentary time out of our lives. We're not saying don't ever be still or be sedentary, but we want to be able to limit that. And particular screen-based time, a lot of the time, because that's linked to other sort of health behaviors like unhealthy eating, and also breaking up long periods of sitting as often as possible. And you can see the implications of that in things like wearables, activity monitors. So you get prompts on your watches or your wearables to tell you to get up more regularly. That's really linking into those guidelines. So when we think about those guidelines, you can think of yourself in sort of 4 quadrants. So are you that sort of person that does the exercise but actually spends a lot of their time sedentary? So an active couch potato. Or are you somebody who does the exercise but also moves regularly throughout the day? So you're a super mover. I've done another poll up for you. So what sort of person are you? Or are you a bit of a mix of both? You're up and moving all the time, but you don't really get time to do that purposeful exercise. Or alternatively, so if you can just open those polls, let's see what we are in the audience.
Okay, so we have about, I'll just close our poll here. So we have 8% inactive couch potato, 46% active couch potato, 38% up and abouter, and 8% superstar mover.
Yeah, so interesting, hey? So even lots of people doing the exercise, which is fantastic, but recognizing, oh, I'm probably a little bit too sedentary some of the time as well. And not too many of you in that super mover stage. And that might be what you do as a job, your opportunities, lots of different influences on our behavior, which I'll touch on a little bit more later. So why do we even care? I mean, what is actually happening to our body when we sit for prolonged periods of time? And I'm sure you've probably felt this when you've gone to a movie or you've sat in a conference, when we used to be able to go to conferences face to face, and you've been still for a long period of time and your body feels a bit achy and sore and you feel a bit sluggish, well, you're feeling those impacts of what's happening when we're sitting for prolonged periods of time. And it impacts us in a couple of different ways. So from a behavioural perspective, if we've been sedentary for long periods of time, we're displacing time that we could be spent in other behaviours and potentially reaping the benefits of those other behaviours. So here in Australia today, it's pouring rain. So if I'm making the choice to stay and work from home and be sedentary, I'm not commuting into my work on the bike. So I'm displacing that time that I would have spent doing that more active behaviour. From a physiological perspective, what's happening is that we don't work very hard in our muscles. So our muscles are unloading, they're not working very hard, they're not contracting to clear out those blood glucose and blood fats. And that has impacts on multiple systems. So the metabolic system, the vascular system, the musculoskeletal system. So reducing that muscle activity impacts on things like capillary recruitment and reduces things like your back muscle strength as well. So this slide is from Dr. Patty Dempsey, and it just gives a nice little highlight of the sort of immediate to long-term impacts of the physiology of sedentary behaviour and what happens. What you do see, perhaps, is that there are a lot of question marks in there because this is really an emerging field of science. But you can also see that lots of things happen, and it doesn't happen straight away, and that's why you see those recommendations about getting up regularly but not removing sedentary behaviour altogether. We do need to be able to rest sometimes, but it's really that prolonged, unbroken sedentary time that we're looking to address in our research. So what does this mean long term? So this is some of the evidence from the epidemiological studies looking at the associations between high levels of sedentary time and chronic disease risk. And you see that there's a number of strong associations being observed between, for example, all-cause mortality, cardiovascular disease mortality, and incident type 2 diabetes. There's also some evidence of a dose-response relationship. If there isn't evidence here, or it says limited or not assignable, it doesn't necessarily mean that there's not a relationship. It's much more that the evidence is still emerging. This is a relatively new field of research. And so for these long-term outcomes, you actually need to collect the data and then follow people up over a long period of time to be able to collect that information. As I flagged, I was involved in the 24-hour movement guidelines for Canada, and we went beyond those outcomes that were displayed on the previous page to look at other outcomes. And there we showed that high levels of sedentary behaviour were associated with cognitive function, depression, poor levels of function and disability, and low levels of physical activity, as well as physical health-related quality of life. But you can see there that the certainty of evidence is still low to very low. So we still need more data and more evidence to really inform those recommendations. And if you recall, the recommendations themselves are fairly broad. We don't have those exact numbers. But if you can just think, I need to limit my sedentary time, I need to get up more regularly or move more regularly, that's a good way to go. So what about those people who are in those active couch potato stages? So what happens is that if you're doing exercise, like I said before, that's fantastic, and a lot of people were, but only very high levels of moderate to vigorous intensity physical activity provide protection against high levels of sitting. So this is actually data from the NHANES study. So every little dot in there is somebody, some actual person and their activity time. And so you can see here, if you've got high levels of daily sedentary time, you have to go a long way over to get into the green zone in terms of their mortality risk. You could also reduce your sedentary time, but you have to reduce it by a long way, again, to reduce your mortality risk. And you don't get the benefits as you do from doing some moderate to vigorous intensity physical activity. So it's really reinforcing you need to think about both. And that's actually the quickest way to reduce your risk, is to both reduce your sedentary time and increase your moderate to vigorous physical activity. So how do we do that? How do we support adults to sit less and to move more? There's been a whole body of work done down in the lab. So this is down at the Baker Heart and Diabetes Institute, led by Professor David Dunstan. And he got people into the laboratory. A lot of them were at risk, so they might have had type 2 diabetes or been overweight or obese. and they got them to either sit down for at least 8 hours at a time and do nothing, or they got them up regularly. So it might be a really slow walk on a treadmill or a more brisk walk, or they might have done something like simple resistance activities, so little calf raises like I'm doing now, or sort of small squats, so things that you can actually do at your desk, because they're trying to think of what are some solutions that people can build into their daily lives to break up their sedentary time more regularly. And then, does that even matter? What's the impact of that? So they found quite really startling results, at least in the short term. So the red is the when they came in and sat continuously. So these are all the same people, and they just a crossover study is what it's called. So they did each of the different experimental conditions at different days. So the red is when they came into the lab and sat for a continuous period of time. The blue was when they came in and just did sort of slow walking, and the green was when they did simple resistance activities. And you can see the impact on their mean glucose profiles. So almost right from the start, you see the benefit of regularly getting up. And this is every 20 to 30 minutes they're getting up. So it's quite feasible. It's only like for 2 or 3 minutes at a time. So it's not that difficult to do. And then importantly, that impact lasts. So they finished in the lab. You can see the dotted line when they finished in the lab, and then that impact lasted for the rest of the day. So that's really exciting information. And you can see a similar impact occurred in terms of their blood pressure. So benefits in terms of the light intensity activity or the simple resistance activities on their blood pressure that then lasted across the whole time period. Okay, well, this is really good for the lab, but what about in the real world? What do we do there? So one of the key real world situations that we're dealing with is the workplace, and that's what we're all interested in. There's obviously multiple different influences on our behaviour. So have a little think, how might behaviour differ in these environments? Which setting would you like to be in? So there's another poll question attached to this one. So shall I get you to open up your poll again?
Yeah, the poll is open. Okay, so I'm going to close that out. So we have 63% preferring the first and 38% the second.
Oh, there's quite a few people preferring the second environment, and that's really interesting as well. But you can see how behaviour might differ between the two environments as well. So one looks like you don't have a set desk, and maybe that's a bit conflicting as well. More agile environment. One, you have a set desk, lots of people are around. And the desk-based workplace is somewhere that we focus on because it is a key setting for addressing sedentary time. You saw in one of my earlier slides that adults spend about 56% of their day sedentary. In the workplace, that's more like 75 to 80% of their time. When they're at work, they're spending sedentary. And importantly, a lot of that is in prolonged unbroken sedentary time, which we consider as not getting up at least every 30 minutes. So prolonged bouts is 30 minutes or more of prolonged sedentary time. The other thing about a desk-based work environment is that there's you can address multiple influences at the same time. So if you think about it, it might be a little bit different from when you're working at home, but in saying that, even when you're working at home, there's multiple things that influence on whether you're able to get up and move more regularly. So if you're in the actual workplace itself, there might be occupational health and safety codes. There might be rules about when you can take lunch breaks. There might be locked stairwells that you can't actually access. It might be that it could be really weird to get up more regularly, or you might have that perception that people might think you're less productive if you're getting up regularly. It might be that it's not easy for you to get up and move more regularly, or you might not want to. But important to think that there is multiple influences on sedentary behaviour at work. So to think about that and think about, can we actually address these multiple behaviours? We developed the Stand Up Australia program of research, which is a program investigating the benefits of reducing sedentary time in the workplace. We started with epidemiological studies, so just looking at associations between behaviours. We then took to the lab, so that's some of the things that you saw today. And then we took it to interventions. And then what we're talking about today as well in the third section is the translational program of research we're doing. This is a national collaboration really led by the University of Queensland and the Baker Heart and Diabetes Institute. So we looked at multiple different intervention combinations to address the multiple different influences on behaviour. And our messages were around to stand up, sit less and move more. And so we considered things like organisational level influences, so helping train the champion and to be a role model in their behaviour, giving information and education around the benefits of being less sedentary, providing individual coaching and support phone calls, providing self-monitoring tools, looking at changing the environment. So we put in sit-stand workstations, but we also looked at the impact of what happens if we change the whole environment, so make staircases more accessible. So we looked at all of these different elements either individually or in combination with each other across multiple different intervention studies. And what we found overwhelmingly was that the interventions are highly acceptable to both employees and to organisations. It's really possible to achieve reductions in prolonged sedentary time, and that there are some benefits to this on indicators of heart health without detrimentally impacting on productivity. And we've even seen some studies where there's benefits to productivity. So despite the fact we're getting people moving around the office more, there's no detrimental impacts on productivity. The studies where we put in a sit-stand workstation, so change the individual physical environment, were key for sustainable change, but they weren't sufficient in and of themselves. So those changes needed to be underpinned by relevant policies and raising awareness and building a supportive culture. It wasn't sufficient to just put desks in. So we had this big body of work, and then we had our government partners and people interested going, okay, that's fantastic, but how do I pass that on to my workplaces? Like, this is a research-based study. This is where you've come in and you've paid for some workstations, you've come out and delivered talks, you've put really precise activity monitors, those thigh-based monitors, onto people, and then use that data to then inform your health coaching and then follow people up with telephone calls. That's not really feasible for us to be able to do. So can you please develop a program that's scalable, that's either low cost or no cost, that's feasible to deliver across multiple different types of workplaces, and that's also compatible with our existing workplace health and wellbeing programs. So this is where I'm going to hand you over to Anna to talk about BeUpstanding and how we developed that workplace health promotion initiative and where we're up to with it.
Thanks, Jen. I'm just figuring out how to show my screen. Hopefully that's going to work. So, Jen, I've heard that talk quite a few times, that information, but I always find it interesting. So I really enjoyed listening to that. It's a little bit tricky for us because we're just talking to kind of our slides, so we don't get that feedback. So hopefully you're all still there. Okay, so I have the great pleasure of talking to you about our BeUpstanding program, which has really been, Genevieve, and my baby over the years. So there we are. It's just a little bit slow, my slides. Hopefully that's coming up. This process of getting BeUpstanding into practice has been, it's taken quite a while and a lot of people. We were really lucky actually to get national funding, government funding, to do a implementation trial for workplaces across Australia to be able to get BeUpstanding out there nationally, and to evaluate it. And we're coming to the end of that implementation trial, so we'll have lots of nice data. We have a little bit of data that we'll present today in terms of how things are going. And we really did this with a very multidisciplinary team. So from software developers and interaction designers and product developers and marketing specialists and key partners at a national level and state-based level. So it has been a really big effort. For those of you who are interested in designing workplace interventions in particular, we thought that might be interesting for you to know that we used a product development approach, which is a little bit unusual for us, as researchers, academics in kind of health promotion and workplace health, but it has been something that has been so useful because it's meant that we're always keeping our eye on the feedback from our end users, i.e. our workplaces, and being able to implement changes and iteratively test those changes and always respond to sort of the market need. And our goal with BeUpstanding has always been, it's never been just about launching this program nationally and evaluating it and seeing if it works or not. It's really been about trying to develop BeUpstanding as a national and potentially international program that is really sustainable for workplaces to be able to use in the long term. So this product development approach has been important for us to keep making it relevant and hopefully to set us up for that long-term sustainability. Now, BeUpstanding currently is a free online program, and we've given you the website address there, so you can check it out, and you can feel free to sign up and have a look at the toolkit. It primarily starts off by aiming to raise awareness around the benefits of sitting less and moving more, so that staff know sort of the information that Jen had just presented to you. And then it very much focuses on building a supportive culture for more movement throughout the day. So it just becomes a new norm to sit less and move more. And then that builds to create sustainable change. All of that evidence that Jen's presented, so about 10 years of research into what works to reduce sitting in the workplace, went into designing and building BeUpstanding, but also very much it was informed by our policy and practice partners as well as our end users. So it is a big thing that we have condensed hopefully into something, and we have had really good feedback in terms of it being very user-friendly. These are the main messages: stand up, sit less, move more. As Jen was saying, it's not about demonizing sitting. It really is about making staff aware of the need to have postural change throughout the day. And so we like to say that the next posture is the best posture. And that's something that staff really that messaging really resonates with them. And it's something, because I've worked on various health behaviour change programs through healthy eating and weight loss, but I have to say that this sitting reduction or reducing prolonged periods of sitting message is one that people really like, and they tend to relate to. I think we all relate to how we feel if we sit at our desk for a long time, and how you'd start to feel stiff, and then you might get a bit sore and you feel a bit sluggish. And so there's something that people can incorporate into their day that's going to have an immediate impact, and then obviously a longer term health impact as well. So it is something that we found is quite a message that staff and obviously workplaces do latch onto, and they do like. The core component, or the way that BeUpstanding is delivered, is via a workplace champion. So a workplace champion is responsible for delivering the program in their particular work team. So you may have an organisation that's quite large that will need multiple champions to run in their work team, because it really works best if the staff that are in a team know each other, because you're trying to create that culture of change, and they kind of need to support each other to do that. So we employ a train the champion model, and that has been tested and successful, and we really guide champions step by step throughout the whole program and give them every resource you can possibly imagine, from videos and tip sheets and posters, survey links, to help them deliver the program and also evaluate it. It follows these kind of 3 familiar phases: the plan, do, review. It's called different things, but essentially is a setup phase for workplaces or their champs, which it does vary, but about 1 to 2 months to kind of get the program ready, and then a 2-month activation phase. So it's 2 months of really getting the program messages out for staff, and then a wrap-up phase in terms of evaluating what happened and reflecting on it, and hopefully then planning for the future as well. In terms of the time commitment, that might be something that you might be thinking about for champs. Again, it varies, but on average is about a 30-minute to an hour that champs report that they spend on running the program over that time. Now, we've had a lot of learnings through BeUpstanding, and probably not surprisingly to any of you who would be working in workplace health and wellbeing and safety, is that staff input is critical. I mean, having that staff buy-in and staff feeling like they have that ownership of the program does a lot in terms of that engagement and getting that momentum to go. So we do a staff survey, so a needs assessment, so where we ask, it's an anonymous online survey where we ask staff to, you can see various things that we ask that we think that are important. So, and then the key core component of BeUpstanding is to consult with staff. Before COVID, this was generally in person during, a weekly meeting, staff meeting, but it also has worked very well online. So the idea is that staff are consulted to choose 3 top strategies that best suit their unique needs and their particular culture to sit less and move more. So it's not about us as researchers coming in as experts and saying this is what you should do to sit less and move more. It really is about giving staff an informational video where they kind of understand the benefits of sitting less and moving more, and then coming together as a team and really choosing 3 strategies that they're going to activate over an 8-week period, which helps to kind of build that momentum for change and really that supportive culture. We do talk about the hierarchy of control, and there's the champions in particular are encouraged to help staff choose strategies that are perhaps higher up in the hierarchy. And we're going to do a lot of analysis on the different strategies and what kind of happens in work teams. But anecdotally, I can share that staff tend to choose strategies initially that are kind of quick wins and fun. So you have teams who might be choosing a Mexican wave at 3 o'clock that the manager has to start, or an R&B dance off, or something like that that's kind of fun and gets them in the mood to do, to raise awareness around this and that kind of engagement with the program. But you can imagine that after a couple of months, that's not necessarily a sustainable strategy. And so then at the end of the program, workplaces are implementing strategies that are higher up in that control, so maybe environmental changes or policy changes. So that's just anecdotally, but we're really pleased to see that happening, so that we're having those strategies implemented that can be done in the longer term, where it just becomes the norm now. We're not even thinking about should we be sitting less and moving more. We're just building it into our day, and we have a supportive culture around that. We thought that you might be interested in some examples of, there are so many different strategies. It's amazing how creative teams are, but these are just a few that work in organizations or teams where they're either based in the office, or also hybrid situations, or perhaps if they're always remote. We have come across some unique challenges that we've heard, in these hybrid kind of work environments or remote work environments. For example, stand-up meetings is a very common strategy. We had one team that I can think of that didn't really like the stand-up meetings at all when they went to an online, when they were doing kind of Zoom meetings, because people felt uncomfortable standing up because of the way that maybe the camera was, angled, or they didn't want to show that they were actually in their pajama bottoms. And so this particular team made it then, because they had a policy that you had to put your camera on when you were on a Zoom call, they made it so that you could turn off your camera and move around and stretch, and kind of gave that permission, if you will. I personally love that scheduling the 50 minutes for meetings, so if you have that hour meeting, if you're going back to back to back in your Zoom meetings, if you have like a little break in between that actually allows you to get up and move and have that active break, I in particular find that one very effective. Now, in terms of our impact, how BeUpstanding is going, is it working the way that we hoped it would when it was, in this national trial? Now, as I said, we're coming to the end of this implementation trial, so we will have a lot more data and a lot more papers coming out about what we found. But we do have analysed it in the meantime, and we're very, very pleased to see that the reach or adoption of the program has been very diverse. So, with these types of programs, obviously, we do worry that the people who are kind of least in need will be taking part, in these programs. But what we've seen is that we've had really good uptake across Australia through regional and rural areas, as well as across different industries. So, organisations or that might be considered typically, blue collar work, as well as small businesses with not necessarily a lot of, infrastructure, all the way through to large government organisations taking part. So a real diversity in terms of who this program is appealing to and who's using it. So we're very happy to see that. In terms of, is it, our effectiveness outcomes, is it actually working how we want it to? Yes is the answer. So we're seeing meaningful changes in the behaviour, so reductions in workplace sitting. And then unsurprisingly, that's associated with those key health indicators. So for example, that decrease in self-reported musculoskeletal complaints. So we're really happy to be seeing that. And as I said, there'll be lots more information and data coming out very soon. We have been trying to be good researchers and not just just publish papers. So we have a BeUpstanding blog that is available. You can see the link there, and we try to share findings from the trial and interesting research. And it's been a really good knowledge translation opportunity, not just for us as researchers, but also for students. We've had a lot of students come on board that have been interested in this program, and they've taken little pieces. So if you do check out the blog, you'll see that we do have a lot of different people involved in that, which has been a nice outcome for us. You might be interested in what we do at UQ. So obviously we have a lot of students at a university setting, and so now in lectures, particularly in the schools where Genevieve has the most influence, we have that real at the beginning of the semester, where students get told what their key, the outcomes or the objectives of the course are. They're also really told about the importance of those regular breaks and given permission to take stretch breaks and prompts throughout lectures. I would have to say that role modelling and acceptance are so important. So role modelling, I mean, if you see a manager stand up in a meeting, and you're much more likely to then, oh yeah, we are kind of allowed to, this is a normative, your staff are more likely to do that, and that acceptance. So for example, it may be that a chair of a meeting says that there's a standing agenda item in this particular, weekly meeting where it's acceptable to move around, or please take active breaks. Feel free to get up and move around. And similarly, that acceptance in lectures for students, where their lecturer is telling them, please feel free to move around and stand up. So they don't feel rude, or they don't feel weird doing it, or people know, why is this person standing up? So that goes a long way, just being told that it's okay to stand and move. And then certainly that role modeling, bumps it up even further. Now, we're always about increasing impact. We are always listening to our key stakeholders and our champions and our staff as well that are taking part in the program. And there has been a really big shift, obviously, with COVID. Lots of organisations looking for a program that they can do that's going to help with team connectedness and team cohesion. As part of that, they're also looking for ways to bring their team together when they don't necessarily have them all in the same environment. And it is a little bit tricky to run programs where you can't see what staff are doing, and you can't sort of check in on them on that kind of, informal way. And so we've really been hearing a lot from workplaces that they're looking for a way to support individual staff and bring their teams together. And so we're looking at developing an app to be able to do that. And as I had said earlier on in the talk, we have always wanted BeUpstanding to be an ongoing public health program that's not only national but also international. So that is probably a prompt that if this is something that you're really interested in, from a research side of things, or also being sort of at the cutting edge of what's happening, we would love to hear from you. We love to do research, obviously, with real world organisations and real world people. That's what we're about, because we want to see that impact. So I have included Genevieve in my email, so please feel very free to contact us even if you have any questions, or if you're interested in any other research. We'd love to hear from you. And that's the end of the talk now. So Shelley, do we have any questions?
Yeah, I've got a few questions here. So the first one that I will send to you. So can changing where we sit and our posture also be a means of breaking up prolonged sitting? I often see organizations promoting comfortable chairs or high table desks and offer that as a means to break up desk sitting. Is it best to sit at an ergonomically set up desk while sitting and stand the rest of the time?
Yeah, so I think the quote that Anna said was like the best one to sum up our take on this is that the best posture is the next posture. So no matter how good the chair is, if you're sitting in it all day, you're going to have some of those impacts of the prolonged sitting. So being able to shift between different postures gets those large muscular groups working in your thigh and your buttocks and your back, being able to move between the different postures. So yes, having those different options of the different height desks, having obviously an ergonomically correct chair when you are sitting is great, but really try to mix it up throughout the whole time, and not to stand the whole time either. I heard the tail end of that question was around standing the whole time. No, that's not great either, because standing for long periods of time can also have its detrimental impacts as well. So it really is about mixing up postures.
Great, thank you. We also had a question about how standing can be hard on your body, so thanks for also checking that one off. And are there any resources available that can give you reminders or prompts to move throughout the day that you'd recommend?
In terms of recommendations, I haven't looked into too much. We actually wrote a blog article on this because it's a question that we get a lot, and people are looking forward for those sort of tools. And so I can certainly send the blog article link through for your listeners to put on it, because that has a lot of different tools. And one of our students actually tried the different break reminders over a week period of time to see what was most annoying or useful for her. Really, people find different reminders useful for different things. So there's ones that just shut your screen down. That really doesn't work for some people. Some it's like a nice musical bell. Some it's just a little alert that pops up. So there's plenty of free ones that are out there attached to your computer. We're also looking at things about are there other sort of prompts that we can build or make or use to have that reminders, because it's a really good point from whoever asked the question, because sitting is so habitual, and that's one of the barriers that people say in our research about why they're not sitting less and moving more, is that they just forget. It's really ingrained into what we do. It's ingrained into our culture. So you do need those regular prompts and reminders. So have a look, and I would recommend having a play with a few different ones to see what suits you.
Great, thank you. So we've got another question. If I'm away from my desk for an extended period, I'm worried my boss and coworkers will start to notice and think I'm not good at my job. Do you have recommendations on how we can help others to understand why we're away a bit more frequently?
I mean, Annie, this is about those barriers. I'll let you address, so I don't talk all the time.
I'm trying to think of the ones that I've heard of, real champions. I mean, that kind of, it is that sort of setting up the normative culture where, you know, it's acceptable to do that. I think people have put, there's some, I don't know what the communication channels, they're all various different ones, but I think there's ones where you can, maybe it's Slack or something like that, and you can put a little like note about what you're doing. And so people have put in like, I'm taking an active break, or like I've gone for a walk, or those sorts of things, so that their team kind of knows that, you know, they're not off watching Netflix. So if there's a way that you can kind of communicate that, or perhaps even if you have shared calendars, that's another one that I can think of. So Teams, you know, where you can share your calendars, and if they're putting in a regular, if a particular staff member's putting in a regular, you know, break for lunch, or a 15-minute active break throughout the day, maybe there's 4 of them, or whatever they're building in, so that their team can actually see when they're doing that. So that's, I can think of those examples. But it's really about...
Yeah, I was just going to say, probably finish off your sentence there. It's really about creating that normative behaviour and raising the awareness about what people are doing, so that there's that trust involved in people being away from the desk. We've been to workplaces where people are doing exactly the same job roles in exactly the same physical environment, and one person has no problem getting up, moving around regularly and taking all the active breaks. The other person has a real perception that they'd be thought of as unproductive if they're away from the desk. So some of it is about really getting everyone on the same page around what the goal of the team is to do around those regular postural shifts. And that's the great thing about BeUpstanding, is a whole of team workplace initiative.
Great, thank you. I guess further along that question of, so some individuals may not have the opportunity to influence their full organization and may just be sort of in an individual contributor role. Do you have recommendations on how they can bring these ideas forward to more of the senior leadership team to help them see the importance of having workers moving more?
Yeah, well, the BeUpstanding website actually has a Dear Boss letter that you can download. So that is, if there's something that you're interested in, and it kind of has the business case around, you know, and all the evidence, you know, in a nice, it's a very sort of digestible format. And then there's various resources as well if you want to go into more depth. So I'd really recommend looking at our BeUpstanding website and going from there.
Great, thank you. Further to that question as well, has the research addressed any sort of like financial impact of implementing the BeUpstanding program? I know you mentioned the business case.
Yeah, so we set up the business case of, you know, why you should invest in workplace wellness, which I'm sure you're all very familiar with, but also then through the national implementation trial. So we're nearly finished that up, like we've been saying, but we're looking at the costs in terms of both actual monetary costs, but also time. So we asked our champions to report that. And then we're going to be doing a health economic analysis so we can look at those costs. The vast majority of our champions say that there's no actual costs associated with the program at all. So it really is that no cost in terms of outlay. In terms of their time, it's often part of their job role, so they don't see it as a costly exercise. A lot of people then go on actually to then maybe invest in perhaps furniture or something to make things more feasible. But all of that information is collected when a workplace finishes the program. So it's the 8-week program. The champion fills in an end of program survey where they put in this information, and it actually spits out this great report which has the cost of the program available for them to share with their organisation and managers. So they can actually go, well, this is how much the program costs us to run, and this is the impact. So you have both the effectiveness and those cost outcomes embedded in this automated report that's provided for them. So it's really great.
Excellent, thank you. So another question, if I'm taking a 5-minute break to go upstairs to get a glass of water, wipe a counter every 30 minutes or so, is that sufficient?
It's a great start. So if you add some regular moderate to vigorous intensity activity to that as well, that's fantastic. You become a super mover. So that's exactly right. It's not much. It doesn't sound like much of what we're saying to do. It's actually, that can be really tricky because of all those multiple influences on behavior. But if you're having an active break, so you're up and moving at least every 30 minutes, plus you're adding in that more moderate to vigorous, raising your heart rate sort of activity on top of that, you've got a really healthy day. And you'll see if you look at your 24-hour movement guidelines, you'll be meeting those guidelines.
Excellent, thank you. And similar to that, for people who have to sit for long periods of time, who maybe are stuck in back-to-back meetings or something like that, are there exercises you can do to prevent the problems of prolonged sitting? For example, like ankle rolls or pelvic tilts?
Yeah, exactly right. And that's exactly one of the questions that the laboratory study was looking at. What can we help support people to do if they're just like stuck at their desk or chained to the desk? So we do work as well with call center workers, where it's a similar issue, that it's actually very, very hard to get away from the desk. So I think hopefully you can remember those laboratory studies where they were doing those simple resistance activities, and that was ankle rolls useful because that gets circulation going, or using your whole body weight exercises just takes that up to that next level. So doing while you're at your desk, if possible, just being able to have a stand and stretch break, do those calf raises, do those mini squats, do those lunges. It does, as you've seen, make quite a big impact, and you can just stay still engaged in your meeting, still involved. But it's quite a big act, just getting up out of your chair. Your muscles have to work quite hard to do that. And then if you add some more resistance activities to that as well, that really just takes it to the next level. So there are options. And then hopefully there's a culture that's been built around so that you're not just back to back to back to back meetings. There are like those breaks in between those meetings, or those supported stand and stretch breaks as well.
But you do have days, I mean, everyone has days where you have those back-to-backs, we certainly do. And I think that's that acceptance, like if we're in a meeting and they can see us doing those calf raises, or we're kind of moving around while we're on the Zoom call, for example, or even in in-person meetings where you're kind of doing those stretches and things like that, then that's, you're not just strange, you kind of know that that's part of you doing that for your health.
Yeah, very true. If everyone knows what's happening, it makes it a bit easier.
Yeah, that's right. You're not just like, what is this person? They're making me feel dizzy on the screen.
Yeah. And another question here, does providing micro break exercises positively support implementing these good habits? So I think this would be for your employer or employees, sorry.
Yes, definitely. And because again, it just speaks to those regular breaks. So having a micro break just helps support that. And then, so some people, some organisations, that might need to be formalised, and that's a whole change in process, which has its benefits as well, because then it's allowed and very explicitly allowed. For some organisations where it's a bit more fluid, it might just need to be encouraged in other ways. And like just little things like, maybe if you're on a multi-story building, going to a bathroom on a different level, or having a small cup of water. That's a really common one. So I'm not going to have my big, 2-litre water bottle on my desk. I'm just going to have a cup of water. So I go and regularly go and fill up the water bottle as well. It also encourages those informal interactions around the workplace, which are really lacking. And as we move to the new normal with COVID and go back to, however we're going to be working in this new environment, having those informal interactions is also really important as well. And having those micro breaks helps to facilitate that.
Great, thank you. And this will likely be our last question. But are there ways that you recommend to build in less sitting and more moving for individuals with accessibility concerns, thinking of how we can create a culture of more movement without making those experiencing barriers feel left out?
That's a really great question. And we have a PhD student who's come on board to really delve into that, because that's something that we have really identified as a need, and we're working with people that are experts in that field as well, because obviously Genevieve and I aren't experts in that. So there's kind of a wait and see space The interesting thing, I went to a meeting and one of the champions actually running BeUpstanding was in a wheelchair, so had accessibility issues, and he was the champion going around and telling his staff, you know, you need to take your standing breaks and move more. And he had various resistance exercises that he was able to do in his wheelchair, and I just love that he was the champion. That was great, you know, like, and his staff really were on board, and he loved the program, and we learned a lot from him. So we'll be doing more kind of interviews and deep dives with people like that to find out more about how we can make this program really acceptable across, you know, all different diverse, you know, people with different types of accessibility issues and so on. So that's a little bit of a watch this space.
Great, thank you so much. So as we're arriving at the end of our webinar, I just wanted to say thank you to both Genevieve and Anna for this great Q&A session. I just have a few reminders and announcements before we end the webinar. So this presentation is recorded and will be posted for free on our website, along with the slides and any extra resources. And it will also be available as a free accredited webinar in our WWI eCampus. So if you are an organizational member with ARPA Australia, you receive free certificates of attendance. WWI members will also receive free certificates. To become a member of WWI, please visit our website at www.workwellnessinstitute.org and look at the Join Us section to see all the benefits and sign up. For those looking to receive a certification for this webinar only, please send your request to membership services at workwellnessinstitute.org. Immediately following this webinar, you will be directed to the evaluation survey. We greatly appreciate your input on our webinars, as well as suggestions for future topic areas. All of our webinars are created for public access and supported by memberships and funding sponsors. As always, the upcoming webinar section under Learn and Connect of our website has all of the topics, dates, and times, as well as speakers for our webinar schedule, with our next webinar being held this Thursday on February 24th. Focusing on the topic of the role leadership plays in the post-pandemic workplace, featuring Dr. Lucas Monsani. So thank you again to our audience for tuning in. We look forward to seeing you again at future sessions, and thank you to Professor Genevieve Healy and Dr. Anna Good for sharing your expertise today.
Pleasure. Thank you.
Great. Thank you so much.